Hello, everyone. My name is EJ, and I am going to answer questions about Miss Floyd. So starting off with the first question, what is my initial reaction to this case? My initial reaction to this case is that Miss Floyd, she appears to like just be struggling with like a lot of emotional and physical like stressors and stuff. And I think it may like the both of them are probably like connected in a sense. And like she has like some sadness and some fatigue and some like digestive issues. She also has a hard time sleeping, and she like drinks alcohol a lot. Uh, and I think that that could like also suggest like symptoms of like depression and anxiety and a bunch of like unresolved trauma. I also noticed that like she seems to be hesitant to fully open up about like certain parts of her life, including like her family, her relationships, and like some of her like legal stuff that she's had happen to her. Um, and uh, Also like alcohol use and like stuff that has went on like within her job and stuff like that. So it just basically just will show you that like just the trust in the report building will be, very important when it'll come to like working alongside with Miss Floyd. Um do do you think you could work with Miss Floyd? I think I could work with Miss Floyd. Um if so, why? I believe I could work with her because I would approach her with like empathy in a sense. Um, I would probably be patient, and I'll probably put like some cultural humility into play as well. Cause she seems unsure just about like therapy and like she seems very hesitant to share like some personal details about her life. Um, and I think it'll be important to create that safe environment, to create that safe space for her because she needs it. And, she needs to be in a situation where she won't be judged because everyone would want that, right? So I feel like she has to be heard. And I also think that it's important to just recognize her experiences and, like, her, for one, just as a black woman and her upsetting experience, with the police and how that might affect like how comfortable she is when it comes to like just working with the system. Because I can understand like us as black people and just our struggles with the police and the medical field and just it's a lot of trauma behind that. So I can understand. So I feel like building that trust would definitely need to be that would need to be the first thing, the most important thing, before pushing for some kind of like disclosure. Um, if so, why not? She Miss Floyd has a lot of strengths within her. Just from reading the assignment, like she has maintained having a good job. She does have her bachelor's degree. She does have like supportive friendships with like Felicia and Tara and Latasha. She also has demonstrated like strengths by seeking a lot of help. Even when like she hasn't really participated in like any type of mental health services. Um, I would say despite her like struggles, she is like functioning how she's supposed to in like a lot of the areas in her life. She's very like resilient and she's very like she has a lot of perseverance. So um yeah, I definitely can see like those are some of her strengths. What are 5 questions you would want to ask Miss Floyd in the second session, and why are they important to ask? 5 questions that I would ask Miss Floyd. The first would be, um, I would ask her if she could tell me more about like what's been affecting her sleep and her mood. Like I would like to take a deep dive into that, because it could really help, I guess, peel back the layers and really help identify, okay, what are the stressors? Like, is it anxiety? Is it depression? Is it like trauma related things? Like, you never really know. I will also just ask her what a typical day looks like for her. Like, just an insight on just what she does on a daily basis, her routine, and just basically like just that kind of stuff. And just how she copes. Um, I will also ask her like if she could share more about the police situation and how that might have like impacted her or changed the trajectory of a lot of things for her. Because she described it as a very like upsetting experience, and I feel like that might play a part in like her emotional distress and why she has trust issues. Because I mean, that's very like understanding for the most part. I also would ask her as like about her alcohol. Um, like dealing with that. Like, how does she feel like the alcohol has been? Does if she feels like it's been more helping her or harming her in a sense? Like, I want her to be able to be in a space to talk about the alcohol where she doesn't feel like she'll be judged. You know, um, and I think the fifth question that I would ask, like, who do you feel most supported by at this moment? And I feel like she can maybe inform you on who she feels most supported by, whether it's her family or friends, and how we can like maybe incorporate that into her treatment. Um so overall, like looking at this case, I really liked it because I feel like it was a normal case. Um and I feel like she's every just any other person, within America, especially black women that, go through the same struggles, and, you know, it highlights the importance of just her patience, her, empatheticness, and just creating that relationship, just built on trust and just cultural responsiveness. So, um, yeah, overall, this was a really nice case, and I enjoyed this case. So,